We have passed the 2-year mark since the first case of COVID-19 was identified. In fact, it was in the Pacific Northwest. There has been a lot of disease and death since then. But even with the Omicron not yet peaked, Multnomah County health officials Dr. Jennifer Vines and Jessica Guernsey are preparing for what they hope will be a slow, steady climb out of the pandemic.
We are still optimistic about the one-way street. I think the major caveat, let me just get that out up front, is that the virus calls the shots.
The virus calls the shots, but eventually we will get to a place where COVID becomes endemic, meaning it doesn't disappear, but fades and is more manageable with other priorities.
I think part of our job is understanding that there's real fear and there are risks that come with COVID, but starting to broaden our view of what it is we're trying to do here around health and health of the county in particular, and having to zoom out a bit from just COVID.
These health experts say zooming out does not mean giving up. And that is especially important addressing ongoing racial and ethnic disparities that COVID has more fully uncovered.
When people ask me, are we ever going back? We shouldn't go back. We shouldn't go back. And what I mean broadly by that is that we have numerous health outcomes that are devastating in BIPOC communities that we need to continue to focus on.
For now, the direct and indirect effects of the virus continue. And while this spring may provide some relief for respiratory illnesses, there is no date set for leaving the pandemic.
But I think in general, the hope is that with time and with enough of us getting some level of protection, that COVID becomes less disruptive to our lives, even though we still have a clear mandate to protect those who are vulnerable to it.
Tim Gordon, KGW News.